Alright, so for this part, I'm not stress him out too bad. He's already getting kind of worked up. We're gonna have to lay him down with his chest over this hole.
Yeah, hand it to him.
And either hold this leg here or hold his scrot so he doesn't move.
Okay.
I'm just gonna take a quick peek.
Just gotta chill for a little bit. And they told me to look at his gums to see if they had color, and they weren't blue, but.
Alright, so his heart has gotten a little bit bigger since last visit. Oh, I didn't need to do that. And forgive me, remind me again, other than the Lasix, are we doing any other meds right now?
Atenolol and Nasopril.
Okay, so we already are on 3.
So just like the left side of his heart has got bigger?
That left atrium, yeah. And that probably, you know, what I think might be happening is rather than the fluid getting outside of the lungs, it might be that he's getting a little bit of congestion, and we might need to increase our dose of, we might need to increase our frequency of the Lasix. Rather than once a day, we might have to go back to twice a day and see if that helps. That's the only thing I'm seeing is that left atrium has gotten bigger. As far as the pleural effusion, that little bit right there, that black space, that's very, very, very mild amount, and not enough that I would feel comfortable sticking with a needle. So that's kind of similar to last time. Last time.
So is it the muscle wall that's got bigger?
Well, it's the what really has happened. What I can see is that his left atrium has gotten more dilated because his heart not more, but every time his heart beats, there's an increased pressure going back into his left atrium, and over time that causes more and more dilation.
Right.
So the heart's getting bigger because it's a pressure problem. It's also a relaxation problem where his muscles are. He's beating so fast, that's why the beta blocker, the atenolol, to slow the heart rate down. So it's that, but also just how rigid the heart is. It needs to relax a little bit more.
And even when he's sleeping, it's so fast.
Yeah. So I need to look at and see if there's anything else we can add to our protocol to try to slow that progression down. What I might do, because I think it might be more telling than this, is since the pleural effusion doesn't seem that significant, I might, before we go, just see if we can take an x-ray of his chest to look at his lungs and see is there more fluid in his lungs than outside of his lungs. So let's go back to the exam room real quick, and then I'll get set up to do that.
Yeah, that wasn't that bad.